that the technology is starting to help us identify and certainly document. I'd say in terms of helping to address that, there's this gap in terms of, how do we make sure that then if you identify a patient with a given social need, that within the EHR, there's a way to identify local resources that are appropriate for that patient, that are near their house, or for example, like if some housing agencies, won't take people who are under a certain age, or won't take men, or won't take people with a criminal history, or something along those lines. So you have to make sure that the resources are appropriate to a given patient before you refer them. You don't want to send someone to a resource that they can't actually use. And then the biggest gap is this closing the loop. If you've got a community, if you've got a healthcare provider, they're referring a patient to the food bank. Can they find out that the patient actually made it there, that they accessed the resources? Can the food bank know that patient's there because their medical provider sent them? I think that's a real gap. Both how do we make sure that there are appropriate, up-to-date community lists, available that you could access quickly again through the EHR, and how do you close the loop so that the care team knows that the patient accessed the services that they were sent to, right? Because otherwise you'll have a care team referring a patient, again, for example, to a food bank, and then saying, okay, well, we took care of that. But actually the patient didn't make it to the food bank because they maybe have a transportation barrier, and they didn't take that on, for some reason. So they might look in the EHR and say, oh, well, I refer this patient for food, to address their food needs, but you don't know that they actually made it to that resource unless we had a way to close that loop. And I don't have an answer for that yet. I know there are some agencies, some entities out there trying to solve that problem, but we don't have anything that's being applied, nationally. It's kind of a couple different experiments going on around the country.